Why is there an increase in mental illness in students both in primary and high school, and why is medicine deemed the go-to solution?
Well, thank you. That is probably one of the most important questions that we face right now. There's an increase in people coming forward for help with mental health problems because, and this is a good thing, there's not as much stigma now associated with mental health. When I was at school, nobody talked about mental health. If you felt you had a mental health problem, it was something you kept to yourself and kept hidden. People feel much more able now to come forward for help. But that means we've got a big responsibility to make sure people can get the help they need and get it in the right place. There is, I think, just now a tendency for medical solutions to be the priority, and some people need specialist care and medical solutions. But what we want to do now is also build up more help for people in communities, including in schools. So you might have seen last week we announced a plan to increase the number of counsellors in schools so that young people have access to people they can talk to make sure they keep healthy mentally, but if they feel they have a problem, to get some early advice and support that might then mean that they don't need to be referred into more specialist services. So building up that community access is a really important priority.
Okay, Ellie, do you think the First Minister, did she answer your question? Did you answer the question why there's been the increase?
I think more people feel able to come forward, so
right.
That is part of, well, that's part of the answer. I suppose there's also a sense that, you know, the pressures on young people today, in some respects, are maybe greater and more complicated than they were when I was growing up. Social media, for example, I think creates, it's a good thing, but it creates additional pressures on young people, maybe opens them up to bullying, for example, in a way that wasn't the case in previous years. So two things I think account for the increase, that and also the fact, which is positive, that people feel able to come forward for help.
Being someone who's went through the system, there is a long wait and process to get to these systems to help others. So what is going to be put in place for the people currently in these situations?
Well, there's some short-term work being undertaken just now to speed up access to specialist treatment, and particularly to try to get quick treatment for people who've been waiting a long time, because we recognise that part of the problem of increasing demand is that people are waiting longer than we want them to wait. Over the longer term, part of what we're trying to do is what I was talking about a moment ago, is build up the provision of services in local communities. So I spoke about school counselling services. We also have plans to introduce a mental well-being service for people aged 5 through to 24 to make sure there's quick access to counselling or peer-to-peer support. So if we get that right, then hopefully fewer young people need to go into specialist care, and those who do need to go into specialist care get quicker access to that care.